obesity can have tremendous impact on different parts of the body, including the immune system, including your physical ability to breathe because of chest wall dynamics, your ability to take a deep breath, the ability to clear out the lungs. Obesity can have an impact on your heart. Obesity can have an impact on your endocrine system by causing prediabetes or full-blown diabetes. And obesity has many other impacts on the immune system that we're not even able to measure or quantify. So clearly, obesity is a significant risk factor for getting more severe illness, not only from COVID-19, but from many other illnesses as well. What level of obesity? That's also unclear. In studies that have looked at this in COVID-19, clearly people that have the highest BMIs, those that are above 40, are at the highest risk. But we see this going down even by 5 points in the BMI, that you still have significant risk. So while 40 is higher than 35, 35 is still high. And while 30 is less at risk than 35, 30 is still a higher risk. And even going down to a BMI of 25 compared to a lower BMI, there is some risk in patients who have those levels of BMI. Therefore, we do recommend that people be aware of that as a risk factor. And it's not a risk factor that can easily be controlled, albeit we obviously recommend that people exercise and eat appropriately as best as possible across the full range of BMIs. Obviously, it's not good to have an eating disorder that will cause you to have too low a BMI. It's not good to be in an emaciated state. That's also not good. So we recommend good, healthy eating for everybody. And at the same time, recognizing that having an elevated BMI above a certain level can impact your ability to tolerate certain illnesses, such as COVID-19, with unfortunate great statistical accuracy. So that is why we do recommend that people be aware of this as a risk factor, and those that have underlying medical problems, such as a risk factor for having more severe COVID, we do recommend that they especially make sure that they're vaccinated and boosted. We do recommend that they be the ones that be more cautious in indoor settings when other people are around, that they don't know their status, and the more the room is a small room, a poorly ventilated room, that they're the ones that take a little bit more of a precaution than a person who doesn't have that risk factor of their underlying medical illness. But again, COVID is non-discriminatory. COVID can attack healthy, thin, young people as well. So we recommend everybody to be cautious and careful and take the appropriate measures to prevent getting serious illness.